This lecture is about the auditory system. We will start with some basic anatomy of the ear, which will be followed by symptoms and conditions. We will review the main diagnostic tools and treatment options after focusing on the questions a doctor should ask if he suspects an ear condition. So let's start with the anatomy of the ear. The outer ear consists of the pinna, or the auricle, the external auditory canal, and the tympanic membrane, or the eardrum. Near the exterior opening, the external canal contains a few hairs and specialized sebaceous glands that secrete cerumen or ear wax. The middle ear, or tympanic cavity, is separated from the external ear by the tympanic membrane or eardrum, and from the internal ear by a thin bony partition that contains two small membrane-covered openings, the fenestra ovalis or oval window and the fenestra rotunda or the round window. The anterior wall of the middle ear contains an opening that leads directly into the auditory tube or eustachian tube. Extending across the middle ear and attached to it by ligaments are three tiny bones called auditory ossicles: the malleus or hammer, the incus or anvil, and the stapes or stirrup. The inner ear is also called the labyrinth because of its complicated series of canals. It consists of two main divisions: an inner membranous labyrinth, which is filled with endolymph, and the bony labyrinth, which contains the perilymph. The bony labyrinth can be divided into three areas: the semicircular canals, the vestibule, and the cochlea. Now let's pass on to the main ear symptoms and diseases. Inflammation of the middle ear is called in English otitis media. Total hearing loss is called deafness. A roaring, ringing, or clicking in the ears is called tinnitus. An earache is called otalgia. A condition in which a new bone is deposited around the oval window is called otosclerosis. The cause of excessive stimulation of the vestibular apparatus by motion is called motion sickness. An increased amount of endolymph leading to hearing loss, vertigo, and tinnitus is called Meniere's syndrome. Now let's review the question you may want to ask a patient if you suspect an ear problem. If you want to inquire about tinnitus, your question is going to be: do you have ringing or buzzing in your ears? If you want to inquire about vertigo, your question is going to be: do you have dizziness? Hearing loss, your question is going to be: can you hear properly? You may want to know if your patient is in pain, and your question is going to be: are your ears painful? With our next slide, we are going to have a look at the main diagnostic tools. Hearing test provides an evaluation of the sensitivity of a person's sense of hearing and is most often performed by an audiologist using an audiometer In case of earache, direct examination using an otoscope and a laryngoscope is performed. Now let's have a look at treatment options. First, you can prescribe ear drops containing antibiotics or corticoids. A hearing aid is a device designed to improve hearing. A cochlear implant is a surgically implanted electronic device that provides a sense of sound to a person who is profoundly deaf or severely hard of hearing in both ears. Earplugs are devices meant to be inserted in the ear canal to protect the user's ears from loud noises. Thank you for your attention.